Today is Wednesday, August 18th. I came to you last Wednesday with an update. Here we are a week later. And last week I reported that we had 214 patients in the UFL Shands Hospital. We had 44 ICU patients. 1 week later, things are still changing. So this morning, as of 6 a.m., we had 238 patients. And now we're up to 63 ICU patients. 63 is an all-time high. We also have hit a new high with pediatric patients. We now have 15 today. 4 of those are in the ICU. So for those of you inside UFL Shands Hospital, you know that the stressors are just mounting. We've had to open more ICU units in other areas over the last week. As you know, we had postponed a lot of elective procedures given the rise in the ICU beds. We will likely take that next step of continuing to look at how we change the elective schedule. It's more and more and more work on all of you. The faculty, the nurses, the housekeepers, everybody that's involved in the care of patients. Your workload is 2 and 3 times more than it ever was. So we need to figure out how we create a little more capacity for beds, try to create some relief so that people can help you. Because the numbers do inch forward. Little ironic that last week I was a little happy to see that the numbers had stabilized for a couple of days. In fact, I said it had stabilized, but let's not call it a trend. A week later, good thing I didn't call it a trend because it didn't. And around us, the situation is just as complicated. This past Saturday, 5 days ago, up in Columbia County, and I've referenced the Lake City Medical Center several times, but in Columbia County, the 911 system let us know that the Lake City Medical Center had reached their limits of their oxygen capacity. So it's not that they ran out of oxygen, but they reached their limits. And so 911 advised us, as well as other hospitals, that they would not take patients to Lake City that might have oxygen needs. And so it got pretty dicey. They were able to solve the problem in 12 to 18 hours. Thankfully for North Florida, quite honestly. North Florida Regional Medical Center stepped in and offloaded many patients that had oxygen needs to North Florida so that Lake City could still be there for its community of whatever's needed that's not COVID. So the situation around us is really complicated. In Ocala, they're seeing record numbers. We often talk about the vaccination rates in Alachua County, that they're strong and we want them better. Both are true. The counties around us are struggling with their vaccination rates. They really are a lot lower. And since Alachua County is not in a bubble, right, people from the outlying counties work here. They shop here. Some of their kids go to school here. So we do need to pay attention to the outlying communities. It's just how that works. So we will continue to share the message of vaccination. I would encourage you to be the ambassador of that news. Certainly inside our clinical facilities, that is now something that's a lot more real for all of us. As you know, Dr. Nelson sent out an email, which I support wholeheartedly, that we encourage everybody to be vaccinated. If you are, you'll receive a sticker. And if you're not vaccinated, you're not fully vaccinated, you have to wear an N95 mask. It's there to protect you. And because we need a healthy workforce. We need everybody to be here for our patients, and we want you to be healthy for your families. So please be the ambassador of the message of vaccination, and also please help convey the message of the importance of masking. At this point, there should be no question that a mask-wearing scenario helps people around the person wearing the mask. There should be a little debate. And I know in our community there is debate. And it's not that masks don't work. They work in the way that they're intended to work, that the person wearing the mask doesn't spread it to others. Please encourage us around us, everybody, We can do this together. But despite what we have to do in our community, you have these record numbers in our hospital. You're taking great care of patients. You're doing all the other things that you need to do for patients that don't have COVID. I remain in awe of what everybody does that takes care of our patients. And I remain in awe of the entire UF Health family that is supportive. Because I think everybody understands that this duration, nobody could predict. But it's here and it's real. And we just have to work through it like you're doing. You're doing it every day, every minute. Thank you all for what you're doing.